Now we start scanning the obstetrics ultrasound of third trimester by using convex probe, placing at transverse position at suprapubic area. Here we see the skull of fetus. It indicates that the fetus is lying spheric position, which is normal. Now we slowly sliding the probe to adjust the skull to take the biparietal view. To adjust at Anomaly to get the arrow sign. Now we adjust the skull at dual mode. Now we rotating the probe at its axis at longitudinal view and slowly sliding towards upside. Here we see the neck of fetus. If we don't find the neck of fetus, we slowly slide the probe right and left. Now slowly sliding upward, we see the heart. These are ribs and this is right lung, which is normal. Now we will take the superficial view of the chest of the fetus, which appears to be normal. The heart and lungs are present and cardiac activity is also present. Here we see the liver, which also appears to be normal. Now slowly sliding the probe. Here we see the spine of fetus. The hypoequic line between the vertebrae is spinal cord. The spine of fetus is also normal and we see no defect. Now slowly sliding probe, we see the hypoequic area. This is urinary bladder. Now when we find the urinary bladder, we slide the probe right and left side to find out the femur of fetus. Here we see the pelvic bone. And this is femur. Now we slowly sliding the probe to take the clear view of femur. Now we will rotating the probe to take the longitudinal view of the femur. Remember that there will be no curve in the femur bone because it will give the difference in the gestational age. Now we will take the measurements of the skull and the femur of the fetus. For skull measurements, we take the biparietal diameter and it should cross the thalami of the skull. The measurement of skull will start from the outer point of first parietal bone and cross the thalami and then the inner part of the second parietal bone. And for head circumference, we will take the size of cranial bone, and for femur, we take the proximal end of the femur bone to the distal end of femur bone. Now we will take the abdominal circumference of the fetus. For abdominal circumference, we will take the measurement where we find the vertebrae, stomach and aorta. And remember that the heart and kidney should be excluded, and we will take the measurement between the heart and kidney. As the patient is lying slightly lateral position, here we see the vertebrae and this is gastric bubble. For abdominal circumference, we will take the cross-section view of the abdomen. Now we will take the heart rate of the fetus by using M mode. Here we see the cardiac activity of the fetus. The heart rate measurement is different in different machines. But remember, when you start the measurements from diastolic point, and the second point will be the also diastolic. Now for Likert measurement, we will take the cross point at umbilicus and we'll take the measurements from upper two umbilicus from right and left and lower umbilicus right and left. For Likert measurements, the viscera should not be included. These are upper two chambers of the fetus. And we will measure the vertically. Now we will take the lower chamber of the fetus. Here we see the placenta at right lower chamber. The margin of placenta are echogenic, which shows the maturity of placenta. Now we will find out the umbilical cord to take the systolic and diastolic ratio. Here we see the umbilical cord, a cross-section views, two arteries and one vein. Now on power Doppler, we will take the systolic and diastolic measurement. The color Doppler machines automatically give the systolic and diastolic ratio. The systolic diastolic ratio should be less than 3 in third trimester. Now how we will write report?